What are the mechanics behind COPD airflow limitation and airway narrowing? Imagine trying to breathe through a straw that keeps getting narrower. That's similar to what happens in the lungs of someone with chronic obstructive pulmonary disease. This condition causes airflow to become limited, especially when you breathe out. So, what makes this happen? Let's break it down. First, in the small airways, which are less than 2 millimeters wide, inflammation kicks in. This inflammation involves immune cells like macrophages, T lymphocytes, and B lymphocytes. These cells cause the walls of the airways to thicken, making the passages narrower. At the same time, the lining of these airways gets damaged. The damage triggers an increase in goblet cells, which produce more mucus. This excess mucus can clog the airways, making it even harder for air to pass through. Along with mucus buildup, structural changes happen in the airway walls. This process is called airway remodeling. It involves thickening of the lining, scarring or fibrosis, and growth of smooth muscle around the airways. All these changes make the airway lumen, or open space, smaller. When the airways are narrowed, resistance to airflow increases. This means it takes more effort to breathe, especially during exhalation when the air is pushed out of the lungs. Now, another key factor is the destruction of lung tissue, known as emphysema. This destruction reduces the elastic fibers that normally help the lungs spring back after inhaling. Without these fibers, the small airways lose their support and tend to collapse during exhalation. This collapse traps air inside the lungs, leading to lung hyperinflation. The loss of elastic recoil also means there's less force pushing air out, making it harder to empty the lungs completely. All these changes work together to cause airflow limitation. During exhalation, the narrowed and collapsible airways make it difficult to expel air efficiently. This results in air trapping, increased work of breathing, and symptoms like shortness of breath. It's important to remember that these changes are usually progressive and only partially reversible. Additional factors like bronchospasm, which is the tightening of airway muscles, and swelling of the airway lining can make the narrowing worse. Repeated infections can also worsen inflammation and mucus production, speeding up the process. In essence, airflow limitation in COPD comes from a combination of airway wall thickening, mucus overproduction, structural changes, and destruction of lung tissue. These factors cause the small airways to become more prone to collapse and less capable of letting air flow freely. That's why breathing becomes harder and why managing these changes is key to controlling COPD.